Welcome, everyone. We're going to start in just one more minute. Please continue to introduce yourselves in the chat box. When using the chat box, please select all participants so everyone can see your comments, including the panelists. Thank you. Welcome, everyone. This is Denise Sulzbach. I'm the director of the National Center at the Institute for Innovation and Implementation at the University of Maryland School of Social Work in Baltimore, and I'm the deputy director of the TA Network. Thank you for joining today's Managing Now for a Better Tomorrow conversation. Special welcome to the TA Network's rural learning community who are joining us today in place of their regular meeting. We will be tweeting throughout this discussion. If you would like to join us, please use the hashtags BetterTomorrow and TA Network Talks, and please tag us at Institute UMSSW. We do hope this conversation finds you safe and well today. We recognize this is a challenging time for all of us in children's services across the country, most especially for families and youth we serve. We have created these conversations for you to have peer-to-peer opportunities, for you to talk with presenters as well as one another. We encourage you to use the chat box, and we see a lot of you are doing that. Great, introducing yourself. Please continue to do so and share your thoughts and resources throughout this discussion. As I said before, when you use the chat box, please select all participants. This will allow everyone to see what you are sharing. In follow-up to today's conversation, we'll send everyone who registered a link to today's recording, as well as all of the resources and insights that you have shared in the chat box with each other. This will very much be a conversation today. You will see the presenters joining us from their homes, and we will not use a PowerPoint during the discussion. And this series is truly about managing now for a better tomorrow. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. And we truly value your participation. We also value your patience with Wi-Fi connections, and we know you understand that from the rural community perspective. So if you lose us, please log back on. And if we lose you, please stay with us. We have a troubleshooting team who's very good at this now. And if you lose one of us, we're good at covering each other. So please thank you for your patience, and please continue to come back if we lose you. As I mentioned, this is part of a conversation series. Today's discussion is the 13th one we've had so far. We have recordings available, including 2 on crisis communications, 1 on in-home behavioral health, 2 on supporting families, and in both of those, we reached our maximum registration of 1,000 participants. 1 on residential interventions. We also have 2 recordings on infant and early childhood mental health, which again reached our max capacity, as well as mobile response and stabilization. School mental health. In school mental health, we have 2 separate discussions, 1 held last week on supporting students and their families, and 1 held yesterday on supporting educators and school administrators. And finally, we held a discussion on housing and homelessness. Please also consider joining us next week. This is a conversation for youth peers and young professionals. It's going to be held on May 5th at 2:30 Eastern Time. And we're in the process of developing and pulling together additional conversations for you, including supporting tribal communities and LGBTQ+ youth. To learn more about the recordings and past presentations and discussions, as well as to sign up for future conversations, please go to our website, theinstitute.umaryland.edu/COVID-19. You're also welcome if you're not already receiving our weekly TA telegram. We do have information on all of our upcoming offerings in that weekly e-blast, and we'll post in the chat box how to subscribe if you're not already subscribing with us. As you know, today's conversation is on rural mental health during COVID-19. And we have a great panel of presenters and panelists for you today. We have Shannon Ravachol. She will be facilitating the discussion today. She's with us at the Institute for Innovation and Implementation at the University of Maryland School of Social Work. Shannon is a senior advisor for system design and implementation with the TA network, and she also wears the hat of system design and implementation coach with the National Wraparound Implementation Center. She's joined by Mac Buckman. Dr. Buckman is from the Stress and Traumatic Treatment Center. He is practicing in Southern Illinois, and he practices in a rural setting. Also joining Shannon and Matt is the third co-facilitator of our rural learning community with the TA network, and that is Christina Hendernoster. Christina is a parent and family, is with the Pennsylvania Parent and Family Alliance, and is an expert in family engagement. Joining them is Liz Manley. Liz Manley is also with the Institute at the University of Maryland. Many of you may know Liz. She is the lead technical assistance support for several states and communities throughout the country as part of the TA network, and she also leads our clinical workforce and best practice work. Joining them is Christopher Belanci. Dr. Belanci is with the Judge Baker Children's Center at the Harvard Medical School, and he serves as the medical director for the TA network. Also joining us, I hope, when we had some difficulty in connecting, will be Sonia Willis-Bacadano. She is with Southern Illinois University. And we have Tony Keck. Tony is with Ballad Health. Tony is the Executive Vice President for System Innovation and Chief Population Health Officer. And with that, I am going to close down our PowerPoint and turn this over to Sharon to welcome us and facilitate this discussion. Thanks again for joining.
Thank you, Denise. And thank you to everyone for signing on with us today. We really are looking forward to hearing what you have to say. As Denise said, this is a conversation. This is not a presentation. And really we want to hear from all of you and want you to hear from each other about strategies that you've been using in your local communities to deal with this time. I think first we did want to have just a little bit of conversation maybe from Dr. Belanci. Christopher, do you want to open us up with some thoughts about, so your initial thoughts about what you're seeing happen around the country?
Sure, and I want to welcome everyone to this conversation and really encourage you to use the chat box to start introducing yourselves and pose questions, comments, resources as we get the dialogue going. Here in Massachusetts, we're in the 7th week of social distancing and essential worker only. And we're still very much in the midst of this. Maybe our curve is flattened, but we have many new cases every day, an unprecedented death toll, where we're seeing significant disparities in who's dying, with much higher rates of African Americans dying than, as well as Latinx and Native populations than Caucasian folks. Which is something I think we're seeing in other large urban areas as well. So I think we need to talk about, structural racism and the ways that that's impacting the outcomes. And I've described this as there was a beginning phase to this crisis where we were all a bit in shock and scrambled to figure out how we're going to meet the needs of the population that we've been working with. And now I think we're kind of in the beginning of the middle phase of this and starting to figure out how do we sustain our efforts, our energy, our empathy, and our abilities to continue to work from home, manage our own families and our families' needs while also being available for our clients and our consumers. And that's no easy task, particularly this far into this endeavor and with no clear end in sight. There certainly are jurisdictions, probably even more in perhaps the rural areas, where governments are starting to reopen to businesses that had been told to be closed. And what the implications are for that work, I think, is still very relevant. How safe do people who are in direct service work, such as many of you, are going to feel to start seeing clients again in face-to-face fashion, and how many consumers are going to feel comfortable seeing you? And so how do we continue to think about and strategize on how we provide the essential services that you're all providing, while making sure that you're safe, your staff are safe, and the folks you're working with are safe? So I think those are going to be some of the central conversation points for our discussion, and I'll really look forward to seeing what creative ideas all of you have come up with, and we'll share some of the ones that we've been hearing about through these conversations so far.
Thank you, Christopher. I'll just echo on that a little bit. You know, those of us in rural communities, some of us are just sort of now really beginning to have the major impact from the COVID-19. We're farther behind than the urban areas, the larger urban areas. And so at the same time, we're beginning to really feel the impact. Many of our states and communities are beginning to talk about reopening. And so I think it puts the rural communities in sort of a tenuous position sometimes, it feels like, and certainly is a different experience than the urban centers that were more on the front end of the impact. So I'm just wondering how people, I really would encourage y'all to ask each other questions, make comments in the chat box, please, you know, address all participants. And I'm wondering if you're having that experience there where you are living of sort of now coming into more of the impact of the virus versus many weeks ago when some of the more urban areas were experiencing. So I would love to hear what y'all's perspective is on that. And maybe when you're as you're chatting that in the chat box, Matt, can we hear from you about some of your experiences there in Southern Illinois and your thoughts about this time?
Certainly. Thank you, Shannon. And thank you, everybody, for joining us as we have this discussion. And just as we do want chat, we want communication, and this is just a space for us to be able to talk with each other, learn from each other. In Southern Illinois, and a lot of people think of Illinois as Chicago. I'm about 6 hours from Chicago. I'm actually, as was noticed by some of our panelists, I actually have a little bit of an accent because I'm from West Kentucky, about 30 minutes from West Kentucky. But I want to speak to, so I'm a licensed clinical and dually credentialed school psychologist, and I'm in the state and get to be the director of the Stress and Trauma Treatment Center. I work with our SIU School of Medicine on a trauma-based behavioral health fellowship. And my specialization is around people that have been hurt and toxic stress and adversity. And as we see this, right, we see the need for how do we manage stress. And one of the ways to manage stress is to support on each other or lean on other people, like that song, Lean on Me. And oftentimes we have these mirroring neurons that are going to impact that how I feel affects how you feel affects how I feel. And especially the stronger attachment relationship. And so one of the things, you know, I'm just seeing some really cool stuff as time goes on, and I'm thankful for our systems of care that are doing innovative approaches and not doing business as usual. Things have changed. As Chris has mentioned, I find people that have talked about self-care and supporting ourselves and supporting our providers and our professionals and our paraprofessionals and peer professionals, we're finding that is so much more of a real need, and that we're practicing that. And finally, I have to practice what I preach, which sometimes I find it's easier to say it than it is to do. And so these innovations, I love to see in rural Southern Illinois, and I'm sure you're seeing it across the nation, where folks have been innovative in using telehealth and Now we have HHS that has really released some of that requirement around using HIPAA compliant. But as we move forward, I'm wondering what happens. What does that look like? And so, like for us, as time goes on, and then I want to pose a question to folks of what examples of how responsive, how innovative approaches that you might be seeing out there in your community. What are some examples of what you have seen? So please just take time, chat that in, and I want to speak to it.
Yeah. If you could lean into your mic a little bit more, your audio is kind of coming in and out. I'm sorry for those who are having trouble understanding.
Totally fine. Thank you. Is this a little bit better?
That is a little better. Yeah, thanks.
Okay. All right. Yes, no problem. And as we're talking about this, internet connection, right? Internet connection and technology, these are things that it's hard to develop relationship with some folks, even in a face-to-face environment. And so sometimes, how am I able to make that connection? So please do talk about that responsiveness, innovation that you've seen. I think I want to learn as much as I want to participate today. And so these connections, I love seeing we're using all types of platforms at this particular point. I see people sending out letters and regular conversations. We've seen our insurance companies and reimbursement change. We're now, and I don't think we're going back. I think we will continue to see these changes that allow for more video and distance types of approaches, which from a rural perspective in Southern Illinois, transportation, getting from one community to another and how isolated we were. One, it's kind of a protective factor when it comes to the contagion, right? That it's a protective factor that actually we were isolated before. So it helps some here in Southern Illinois, but also the barriers to be able to access services have actually improved. Now, internet is still an issue. We have to use certain platforms, consider which platforms are better with low bandwidth versus other platforms. Using Zoom and Doxy.me and many other things. We see school buses going out and they're bringing internet to different communities. Agencies, companies in our rural communities, houses have been unlocking their internet, their Wi-Fi connection, and allowing people to be able to use their connection. Churches have done this. I'm just kind of looking at some of the comments here, and I love that. So please put them in. And so looking at churches and how are they doing prayer services online, and how are they still providing the types of supports that they've always been providing. And the Wi-Fi, we also see like Chromebooks going out where you can check those out of different agencies, and people are able to use them in parking lots and public spaces and parks. One of the other things, and I'll just kind of end here, is please keep posting more, but I'll kind of end here to say, my daughter's 5, and in rural communities here in Southern Illinois, we can actually drive our side-by-sides or razors. It's like a big four-wheeler. And me, my daughter, and my wife drive around town, and there's different activities that community members are doing that even though they're not coming out and going to child events, they're doing things like putting teddy bears in the window, or putting like staging teddy bears or different stuffed animals, or putting out different messages. And for Easter, there were like eggs that were painted on everybody's windows, and then kids could go around and find the different eggs. And so that it be a community approach. I love to also see that our fire stations and our police departments, what we're doing now are parades for birthdays for kids. And so when we know about it, we all meet at the fire station. No one gets out of their car, but we all parade and honk, and you can, use the window markers, and you can decorate your car, and the fire truck drives by. And how cool is that for our young kids to be able to see the fire truck? And just being innovative as a community. And I think that's really something we've lost over, or something that has weakened over time, that there's not only areas of adversity and struggle during this time, there may be some areas of growth and some community that is developed through this time as well. And I think our rural communities are really coming together, the ones that I've seen. That is.
That's great, Matt. Thank you. And thanks to everyone that's chatting in the chat box. We've gotten some great responses there about some creative things that communities are doing to support each other and provide internet access. There is one comment I wanted to to read out to everyone, make sure they heard it. Maybe one of our panelists or two would like to comment on it. It's from Jean Kapler. She says, I think JEA is usually a female, but I don't know. I worry that rural communities have a false sense of security, feel like because of the lower population density, they are not in as much danger from COVID-19. However, we have one rural county in Indiana, Decatur County, with just over 20,000 residents, where there has been an outbreak of COVID and a surprisingly high number of deaths, all traced back to one basketball game. Another rural county, Cass County, where there's a huge outbreak at a meat processing plant, a major employer in the county. I worry that rural churches will also become a point of infection, which I think, there was someone else that said that, I saw another comment that said churches were having virtual services. And so that's, I think some strategies. And Tony, I saw you had commented earlier, asked a question. What was your question about how do we stay vigilant in rural communities when we may have these that sort of false sense of security? I think is reflected in Jean's comment as well. I don't know if anybody wanted to chime in on that.
Sure. I mean, it's a great question and concern, and we've spent a lot of time modeling this. We're an area, our service area, the Appalachian Highlands, is about the size of New Jersey, with about 1/10 the population. We have about 350 COVID cases to date. New Jersey has about 115,000 to date. And so we spent a lot of time trying to understand why that is. And it's true, and you can see it in the data when you look at some of the cell phone tracking data and so on that people have access to now. That a lower density area certainly has a protective effect. You're just not passing as many people, interacting with as many people, and so on. But the examples that were just given in that rural community about basketball games, about a prison population, we're also seeing some of those spikes. And so just a couple counties over from us in an area that's outside of our traditional service area, they had overnight 700 cases pop up because it was a prison population where obviously because of the close congregate setting, it just spread like wildfire. So rural communities are not immune to these types of cluster spreads, which can really increase the number of cases in a community pretty quickly. So is what we're trying to do is in some cases where our local government is actually reducing some restrictions, such as travel, we're now increasing some of our protective requirements, and we're requiring, for instance, all of our employees to wear masks in our health system, even in the corporate office. And so they're now going to be able to travel more freely, but we're going to ramp up some of the PPE requirements that we have. We're also going to spend a lot of time as a health system working closely with a number of these organizations where there really can be a quick cluster spread, whether it be a nursing home, large churches, different types of manufacturing plants, and so on. We've really opened up our testing, and now in our region, anybody who wants a test can get tested, and so we're going to try to make that more available to our employers and educate our employers about the role of taking proper precautions, such as temperature checks and so on, with their own employees.
Thanks, Tony. Speaking of wearing masks, there was a question earlier from Megan Armstrong that asked, how can we advocate for PPE for mental health providers? Has anybody had any experience with that? I mean, I know that's a real issue. So why don't, and I don't know if anybody on the panel has any expertise around that, or if we want some of the participants to chime in with any suggestions that they may have on advocating for PPE. Christopher?
Yeah, this came up in the mobile response and stabilization call. And I think you need to coordinate with your local Department of Public Health. I think we need to acknowledge that any of our workforce working with children with behavioral health conditions and their families who are required to do in-person work should be considered frontline workers, and as such have priority access to personal protective equipment. So we're really talking about those N95 masks, either the ones with the respirators or the ones that are also being used in construction areas. While it's great that there's been an outpouring of support from craft communities, I have a friend who made me a mask. Those are really better to prevent you from spreading the virus to others. They are not as good at preventing you from catching the virus from others. And so really having one of those N95 masks, if you're in a lot of physical contact, probably gloves as well. I don't think this workforce necessarily needs face shields or full protective garments. That's really reserved for people working in nursing homes and hospitals and primary healthcare institutions. But certainly a N95 mask, I think, would be critically important. And so finding and partnering with your public health department to source that, I think, would be really, really important. The last thing we want to do is, in addition to the stress that our workforce is under, that we start having COVID infections and deaths as a result of our workforce being in the field. So we really want to and have an obligation, frankly, to protect our workforce from catching this virus.
Yes, I'm going to welcome Sonia. I'm glad you made it. Thanks for being part of the conversation.
Thank you so much. I apologize I was tardy, but it really was not my fault. I can definitely say that. I can't blame it on traffic right now. But I guess kind of internet traffic. I've noticed I'm on quite a few Zoom calls during the week, and I've noticed recently it's really been much more difficult to get in. So I very much appreciate you having me. I would like to first start by telling you who I am, Sonia Willis-Ficadano. I work with Dr. Matt Buckman, which has been my privilege. I'm a graduate social work student and also in the Trauma Behavior Fellowship. I'm a foster parent, a mother of a teenage daughter, which you can imagine at this time, please pray for me, is very stressful. And just a very active member of my community. You asked the question about how things were going in the rural community, and I'm not so rural being in Carbondale. I'd say where Matt is about an hour away from me and a little bit more rural. And we do kind of have that false sense of security, especially after the stimulus checks came out. I saw a lot of activity on the roads. However, I will say there is more vigilance to, even if they're not the masks that are designed to prevent you from getting the virus, a lot of people are using scarves or the homemade masks or whatever else when they go out. A lot of children still playing out at the parks and so forth, but even children wearing masks. So I would say that in the community, because we do kind of have that sense of fellowship with one another, we are being more protective of one another. The other thing I was going to say has been really difficult, especially working with the clients that I see, is that they depend a lot on family. So whereas the grandmother may have been the babysitter, and they still have to go to work, now that's a great issue. Or if there was victimization going on in the home and the only opportunity the child had to get away was to go to grandma's house for the weekend, now that's not happening. So there are those issues still to be very, very concerned with. And how do you even combat that when you simply just can't be there?
Yes, that is a real challenge. And I would love to hear people's response to that in the chat box. And how are you dealing with it? How are you supporting families when they're under that much stress and strain and have lost their natural supports? There are a couple of questions I want to read from the chat box, but then Christina, I'm wondering if maybe we could hear from you about ways to support families during this time. But let me read a couple of these comments first. So we had one from Shannon Karsten that asked, how are programs dealing with clients' mistrust of others, quote, coming into their homes via video? So I would love for our participants to chat a response to that as well. And then here's another one. Let's see. How would you feel about reintegrating with home-based services and going into homes with families as we plan for the future? That's a really good question. I mean, how much are we going to maintain telehealth services? How much are we going to be going back, you know, and delivering services directly face-to-face with folks? I mean, I'm curious, I'd love to hear from the participants about how much are you really still doing face-to-face? That question about advocating for PPE. I mean, how many folks are still literally delivering services in person versus through some electronic process? But so I'd really like to hear from Christina about supporting families. And then I'm wondering, Liz, maybe you could talk about some of the mobile response, you know, how that's being handled these days. But Christina, can we hear from you first?
Sure, thanks, Shane. Part of what we're finding here in Pennsylvania is that some families are really thriving. Some families are reporting that it's easier to access telehealth so that their children could get speech therapy, physical therapy, and then their mental health visits, because there's not the barrier of leaving work, picking the kids up at school, taking them to their appointment, and making it back. So some families are reporting that things are a little bit more calm and relaxed in their home. But what we're actually finding is that difference, the divide between the families who are saying, you know, things are slowing down, where we have less stress, this is an okay time for our family, is really that digital divide. So families who do not have reliable access to high-speed internet are really the ones who are having difficulties getting up-to-date information. They're having difficulties supporting their children in terms of even just activities to keep them busy. The weather here in Pennsylvania has been pretty rainy, pretty yucky lately, so you can't say to the kids, even like a nice big rural yard, go outside and play. So families are having difficulties keeping their kiddos engaged, having them get access to education. They worry about what are they missing in terms of special education services. And then if you don't have access to a good internet connection, they're having challenges with receiving their mental health treatment. And as we've seen already here today, for some people, if your internet is lagging between your internet and the words that you hear, sometimes that's very challenging for a young adult and a child to really connect with their service provider, because they feel like their service provider is a little less engaged. What we've been finding here are families who load everyone into the car, and maybe they go sit in a local park where they've brought wireless internet connections for everyone. But imagine for a minute that you're sitting in a car with yourself and 3 children while you're trying to do your work and your kiddos are trying to do their schoolwork. That's really, that's really challenging. We also have some families who are actually driving to their mental health provider's office, where a very tiny skeleton crew is letting them in, and they're hooking them up to the internet, and they're receiving their telehealth services while their provider is at home. But because they have no other way of accessing their services, this is how they have to do it. They still have to drive in to receive their services. So really that digital divide seems to be the difference between solid access to information and whether a family is able to thrive and not. But I was wondering if other people had suggestions for how their communities are handling that lack of internet because that's really in rural communities where you have cell phones that don't connect. Maybe many rural communities have satellite TV that goes out all the time when there's storms. So part of what we've been finding too is that lack of reliable information. And in rural communities, of course, rumors fly all the time, which makes it very difficult to get some accurate information out. So I'm wondering what some other places have been doing to get accurate information out to overcome the lack of internet. And I do have a couple examples that to share. We do have in Tioga County, some of our local legislators have taken to doing live streaming on Facebook. So even if everyone can't access it, hopefully enough people are accessing it to be able to spread the word. Does anybody have any other, has anyone chatted in any, oh, I like the kiosk idea. That's a really good idea.
Yeah, I mean, there've been a lot of really good responses. Kiosks in the primary care offices. Someone chatted about free hotspots till the end of June in Massachusetts. Here's one from Tova Nunez says, we are not doing anything by internet because of poor or no internet in some areas of our county. So I am interested to, you know, how communities are dealing with poor connectivity, and also, again, like how much has really, whether it's because of poor connectivity or whether it's because of other reasons, who is actually still seeing people face to face, and you know, what does that look like, and why if that is still happening, you know, help us think through, you know, what the circumstances around that would be. And one of the first things I thought of was the mobile response, Liz, which I'll call on you to address. But then Matt and Chris, you know, you might want to chime in about face-to-face versus telehealth now and going forward.
So yeah, look, with mobile response and stabilization, most of the feedback is that they still have access to go face-to-face. If there is real concern about safety, right? Specifically around safety, danger to self or other type of situations. For the most part, the teams are reporting a couple of really interesting things. One, families are waiting longer, so children are actually demonstrating more concerning behaviors than they would have been prior to COVID-19. Some of the idea about that is some of the thoughts the teams have are that families are a little worried about having someone in their own homes. They're very worried about their children needing to go into an emergency department or inpatient care. And so they're sort of delaying a bit before they're working to access care. But teams are going in. They use PPE, as Christopher talked about. A lot of states have started to say we have to help make that happen. So Connecticut was the first state to take the leap in making sure that that happens, but other states are doing that now as well. The other part that's happening that I think is interesting, back to the telehealth technology component, is a lot of youth are really engaging well with telehealth and like it. They're using it, and it's been a helpful tool in the conversation. However, there are some areas that not just the youth isn't as engaged, but the parent or caregiver isn't. And there is a generational divide between young people who are being raised by their parents and young people who are raised by their grandparents who may not really have great access or understanding of telehealth. So not only is it the issue of can you get it, can you get access to the technology, the next thing is, do they know how to use the technology? But I think there is a big divide, right? There is a big divide right now between the individuals who have good access to high-speed internet and the ability to stay connected with schools, stay connected to their teachers, stay connected to their communities. And the mobile response teams are feeling like that's a big part of what's happening in terms of their success in getting in is the ability to continue to stay connected to all of that.
Mm-hmm. Interesting. Matt, did you have any thoughts on face-to-face versus telehealth and now and going forward?
Yeah. and definitely we're seeing that, right? Like where it can be very challenging to build relationship. We see different generational differences, internet. As you guys notice, even with my internet, right? Like that is a barrier that does get in the way. But we're seeing some sessions like behind the facility now, and people are going for walks or 6 feet apart, and they're still able to connect. There's a lot of front porch therapy happening and front porch check-ins. But folks, I have some clients, and I've heard this from a lot of people I supervise, that honestly, they probably don't want to go back to face if they don't have to, that they see this as a good opportunity. And fortunately, we've been working as a researcher, as a profession in research on what telehealth can be done and what evidence-based practices can be implemented with telehealth and what type of adaptations or applications are there. I'm a big proponent of trauma-focused cognitive behavioral therapy, and so there's some good resources out there and a lot of organizations that are EBPs, and they're providing technical assistance and guidance on how to do that by telehealth. And some even have some randomized control trials to show this does work. And then some of it, it's just the best we can offer right now.
Interesting. Christopher, any thoughts from you or anything else to share?
Yeah, I think even in areas where the pandemic hasn't had significant impact, I still think you have to have a level of heightened awareness that it's not sparing any part of the country. And as you pointed out in your opening, in some ways, it's really just getting to some of the more rural areas. So I do think that if you can do telehealth, it's a really good option right now because it's probably the safest choice you have. And I think what we're really talking about is a risk reduction model. It's not going to be an absolute safe or an absolute disaster, but you want to try to reduce your risk both for your employees, for yourselves, and for the families and young people you're working with. So, you know, some of the interventions that some agencies are starting to utilize are asking questions about whether or not anybody in the family has been sick and the nature of the illness. Obviously, this is primarily a respiratory disorder. And so fever, cough, shortness of breath, chills, those are the more common symptoms. But what we also heard is that this virus can spread even without the presence of those symptoms. So even that's not an absolute certainty of someone not being sick or able to spread the virus. So, you know, but again, I think that helps to moderate your risk by at least asking some of those questions. As schools are starting to open, people are talking about temperature checks and using some of those remote thermometers. Whether or not you do that in this kind of a workforce, probably not. That would feel a little invasive. But I do think it's reasonable to at least ask some questions and whether or not anybody's been around someone who's been diagnosed or has been tested positive. And then even if you are engaging in those face-to-face encounters, because either that's really what the expectation is and it seems to be safe, I would still exercise some social distancing. And some people were talking about some great ideas. And Matt was just also suggesting going for a walk, meeting on the front porch, sitting apart, sitting in the backyard, going on a swing where you can sit on the outer swings in areas where parks are still available and accessible. Throwing a football, you know, so that there's some distance there, although there's still the touching of the football and spreading that back and forth. So, you know, all of these things have implications, and we need to be constantly thinking about the ways in which the virus spreads. And there was some earlier comments about, you know, doing a lot of education, because I think, you know, part of doing good behavioral health is also making sure that folks are taking care of their physical health. And some of that may mean that you're also in a role where you're doing some education about the virus and its means of contagion and asking questions about how young people and their families are protecting themselves and keeping themselves and others safe. So, you know, I think the challenge to this is that we're probably going to be in this until we either get a treatment that works, and there's some recent studies about some antivirals, or I don't know if you can still hear me, or we're able to get a vaccine, you know, and until we have one of those options available to us, the only tool we really have to fight this virus is social distancing and to minimize person-to-person contact. So, you know, I think we need to be in control over what we have control over, which is our behavior and the proximity we expose ourselves to with others. We can't control what others are doing or the virus itself.
But there were a couple of questions that I wanted to kind of get back to from the chat box, and there's been some really great comments and questions coming in. There was one comment I wanted to read from Helena Johnson that said, a lot of people in rural areas have a lot of underlying health conditions due to poverty. So there tends to be a lot of deaths from COVID-19, which I think is, you know, something that we need to be very aware of. But also then it came a question for Sonia from Lisa Girardi. It says, in regards to people of color and the higher rate of contracting and dying from COVID, what are some communities and states doing to address this? And Sonia, I don't know if you have any feedback on that, or other panelists, or I would love to hear from the participants as well.
That's a really good question, and I actually had to do some research when even coming to this talk, because in this area, it's not a great concern. The bigger concern is more communal. It's just being involved with one another. However, in Chicago, where I actually have a lot of relatives that live there, it's a much bigger concern. And people just, unfortunately, we're so used to in our culture being able to be together. We celebrate all the time, birthdays, and graduation is coming up. Here in Carbondale, I heard that they were, when everything first started, they actually had a party in the park. I mean, hey, kids don't have to go to school and I don't have to go to work, so let's go, all go get together, kind of defeating the purpose. Since then, it's gotten a little bit more realistic. We're trickling to have a few more cases, and I think a lot of that has been because the initial information was, well, Black people don't get this anyway. Now we're hearing that that's exactly the opposite because of the lack of availability that they have to care. And not only that, it's, you know, within a culture, we don't even like to go to the doctor. To tell you my personal story, I have a heart condition and I fainted at the grocery store. And when I did, everybody was literally up in my face and I felt like, oh, just get away. And they kept asking, do you want to go to the hospital? I was like, no, that's where the sick people are. So, I mean, it really is, as a culture, we just don't like to go to the doctor, and we will suffer through getting sick until we can't deal with it anymore. So I don't know that there's anything that can be done about that by the government or health officials or anything else to convince us that this is what we need to do. It really is just about trying to be safe so that we don't get sick in the first place.
Thank you, Sonia. I wanted to get back to this one particular question that I saw. Let's see. Lost my list. It was a question, and I can't find it. Oh yeah, here it is. This is from Christine Levine. It says, given how quickly this virus can spread and with many states reopening, I mean, Christopher just kind of talked us through being cautious, but many states are beginning to reopen. The question is, are hospitals in rural areas equipped to handle a surge in COVID cases if that was to occur? So Tony, if you want to take that one. Unmute yourself.
Thanks. That's a good question. I think we've all seen in a number of urban areas where the virus has really grown pretty quickly that their hospital resources have quickly been taxed. I don't think we've ever reached a place, even in New York, where they exceeded the number of ventilators that they needed and so on. So there wasn't a rationing of care. There was certainly using contingent care, using different spaces, using different methods. But when you think about rural areas can get quickly overwhelmed. As I mentioned before, if you have a small rural area that happens to have a large prison in it, which many rural communities might have, processing plants, manufacturing plants, prisons, and so on, they very quickly their local resources could very quickly become overwhelmed if there was a cluster event. In most cases, in many of those rural areas, at least in the eastern half of the United States, it's the distance to a more tertiary hospital, for instance, is not as great, and is typically what would happen anyways with most types of hospital admissions, that you would go to a larger tertiary facility. Out west, the distances are a lot greater, and so there's chances there that local resources could get overwhelmed fairly quickly. And so I think it's important for rural hospitals to have clear transfer protocols with larger hospitals, and so emergency planning on your own is probably not the best idea. You certainly need to be working with your local emergency management and EMS, but you also need to be working with local tertiary hospitals that potentially could serve as a surge partner.
Okay. All right. Well, thanks.
Yeah, I would add that what a lot of the urban hospitals did was pretty much close down to any elective surgeries. They got any non-essential patients out, and in many times that's included psychiatric units. So, you know, it's not a good time to have a psychiatric crisis, unfortunately. And there was a little bit of a back and forth in the chat with someone from Brooklyn talking about the effectiveness of their mobile response team being able to divert young people from needing an acute hospitalization. And I think at this point, whenever you can avoid using a psychiatric inpatient facility, the better off for all, because, you know, even though those units are maybe physically separated from the general hospital setting, you know, that's where people with this virus are going. And so using the mobile response, and particularly the stabilization part of the mobile response, and they were able to talk about how they were able to effectively de-escalate many young people and avert the need for a higher level of care. I think that model is more important than ever, because we really need to preserve the inpatient beds for those with infections. And that's been pretty effective at averting the dire concerns that were initially being raised about hospital capacity. So similarly in Massachusetts, we have not reached or exceeded our hospital capacity, but that's in part because they've converted so many of these beds into ICU beds and kept out other folks needing physical interventions. But that's not without cost, you know. So one of the concerns now that we're getting into a prolonged period of this pandemic is that people with cancer, people with other underlying health conditions are getting their health needs deferred. And that's going to cause some problems down the line in terms of maintaining their physical health as well. And then the stress associated with knowing that you're not able to attend to your physical health needs, particularly if you have underlying chronic health conditions, is really an additional burden that these families are carrying.
Yeah, we're seeing a lot of that. I think a lot of rural communities are seeing that people are not attending to their physical health care needs and are having some dire impacts at home. But again, in the case of the hospital beds, I mean, we're in a case. I'm in rural Tennessee, and the governor has issued an order to reopen, for the hospital systems to reopen non-emergent services. So again, it's kind of, we're in an odd place of begin to feel the impact of the pandemic at the same time, while the more urban settings have progressed, past their peak theoretically, at least the initial peak. So the states are taking some measures to open. So we are in kind of
Shannon, if I could just chime in on that as well. One thing that kind of happened in the urban areas is that they had a surge when they weren't prepared for a surge. Mm-hmm. And I can say, unfortunately, I've had the opportunity to go to the ER, different incident. And here in Carbondale, we are very, very well equipped and ready. I didn't have to wait. I showed up at the ER. They were right there. I didn't go to the waiting area where they normally do all of your diagnostics. I went straight into a room. The room happened to be connected to the X-ray room. So I would say, at least, if a surge would happen, because it's a smaller area, it would be difficult, but at least they're prepared to accept whatever does come their way.
Great. And there's, it looks like we're trying to get some of the problems straightened out with WebEx, and we're trying to work with their technical assistance people. So again, I apologize for the technical difficulties. There's a lot of good comments in here. Here's, even our nurses are being furloughed in our rural hospitals, even though there are a few patients with COVID, but there's no same-day surgeries or other treatments. Again, that's going to be, a lot of these things are going to be transitioning in one direction, and then who knows what's going to happen, depending on how we all respond with the social distances and the staying safe measures, how that will continue to trend. Here's another comment from Monique Hicks. To me, the idea of open versus closed is too black and white. It isn't the reality, but I think it conveys false expectations. Interesting comment.
Shannon?
Yes.
I want to go back to some people had mentioned a while ago about families not wanting to allow people to come into their homes via the web. And I'm wondering, since we have so many people here who could maybe give us some insights, we are really concerned about the extra stress that families are feeling and how that is related. While less people are calling into and going into domestic violence shelters, and there's less reports of child abuse, when we do see those, we see them at the extreme levels where there are extreme injuries or even death occurring. I'm wondering if anybody, whether you're listening, if you have any input, or our experts here have any suggestions on how rural communities are handling keeping an eye on our most vulnerable who maybe have some abuse challenges.
Yeah, please chat in the chat box and let us know how your communities are addressing that. I mean, it's a significant concern in rural communities, in particular. In many of these rural communities have been dealing with the opioid epidemic over the past few years, and an increase in child placements as a result of that. And so, let us know how you're addressing those concerns, and how your and how your community is responding in terms of still addressing the need for treatments for those addicted to opioids and having other substance abuse disorders. And so let us know how your communities are addressing that, please. I'm going to read a couple other comments that came in through the chat box. One said, could someone please address unique aspects of the rural communities dealing with COVID-19? In the poor, relatively insulated community in which I work, for example, many are very angry that, quote, they canceled all high school graduations. There is a disconnect between the pandemic and their lives, almost a denial thought. I will say, you know, I want to open it up to Christina and Matt too, who are living in rural communities. That's very much the case in the community where I live. You know, people are angry that their lives are being disrupted and their seniors are not, because rural communities are very strong social networks, you know, and these community traditions are very important and very meaningful, and people build their whole lives around them, whether it's a Friday night football game or, you know, the high school prom, graduation. And so there is sort of a sense of loss around here. People can get very, very emotional about not having the ability to participate in those things and feel like they've been, you know, robbed of a major event in their life. So I think it does add to the sense of stress and anxiety, and, you know, people can feel overwhelmed, out of touch with their normal lives. So I wish I had an answer for it. But
I can tell you how one rural community is handling that, because in our little town of 1,500, people were excited about 6th grade graduation. And, you know, in larger communities, they don't celebrate those milestones as much as, like you were saying, it's an opportunity to get together. We have a lot of communities where, yes, there is that anger. And so the communities have rallied around, and they're working on drive up graduations, where people will they're planning to ring the football fields with cars, and students will be able to actually walk across the stage in their cap and gown and pick up, you know, a diploma for pictures without presenters on the stage using loudspeakers. But it is really, really traumatizing. They're talking about certainly high school graduation, but in some ways, you know, people aren't talking about those smaller opportunities to get together. But I do have to say that I feel like rural communities are used to taking care of their own, because they don't always have access to the same services that they may have in larger communities. So they are pretty quick on the fly to come up with ways of getting together and coming up with some creative solutions. So I really liked the idea of the football field graduation in your cars. Wonder if anyone has any other suggestions.
there are a few things in the chat box that people have put in. Let's see. Our high school, Virginia Wade said, our high school has not announced the graduation replacement ceremony for our seniors. However, they did get permission from parents to feature them on their school Facebook page and invited community members to adopt a senior, and they had a great response.
I've heard of that even with Adopt a Kindergartner. And the other suggestion, sorry to jump in on you, but the other suggestion was that some local printing areas, you were able to get a yard placard to put into your grass, acknowledging the fact that you had a senior who lived there, and people would drive by and put balloons on it. And like you had said, adopt a student, people would send them small gifts. So not the same as getting to watch your precious child finally walk across the stage, but still a way of acknowledging that.
Yeah. And then I would encourage people to check out the chat box. There are a number of other comments in there about how communities have been able to be creative in supporting their seniors and having other community celebrations.
And like Tony has said, Tony had mentioned this on here, TV stations are now picking up some of these events too, and being able to highlight different seniors and different graduates. And there's some Facebook type of ceremonies. There's some things that are out there that I think folks are pulling together and finding a way.
Yes, and so I think there have been a number of creative things. So I think it's important just to try to, you know, promote those things, and again with the eye of the long-term view, you know, that what we do now matters later. and just support each other and support our families as they're dealing with that. There was a comment in here, and I'm looking that people, which is not, of course, not unexpected. I can't find the exact comment right now, but it was people's anxieties, stress levels. You know, obviously the providers are seeing clients whose anxiety and stress levels have really been exacerbated. And that generally people are generally stressed and have experiencing a lot of anxiety. And so I don't know if any of our panelists want to comment on ways just to try to mitigate some of that, to support people either as professionals working with clients that they've had long-term and seeing the impacts on those, or just, you know, supporting families in general. Any ideas around that? Who wants to chime in?
This is
Oh, go ahead, Matt.
Go ahead, Sonia.
Go right ahead, Sonia.
Well, I just want to say two things. I am a graduate and I would be attending a graduation ceremony. And as far as anxiety, kind of the two together, having the virtual graduations, I feel like is a good idea because it gives you just a second to not think about all this looming virus things that are going on. So as far as that's concerned, I'll also be attending other high school graduations. And for the kids, I think it's not only a way to acknowledge their accomplishments, but also to say, you know, hey, this isn't the end of it, and we're still celebrating you, and there's so much more to come. So I think it's really going to be important to encourage those and to kind of alleviate some of the anxiety that's going on right now.
Great. I think that's a good point. Matt, were you going to say something, or?
Yeah, I'll just speak to the impact of loss. And so this impact of loss and how I oftentimes talk about or think about like the phases of grief and how that looks different for all of us, that we don't actually have to have lost a loved one, but to lose certain portions of our life and some things that like events and graduations that are always going to be a loss in some way, or it's different, and it will be different. And this will probably define this generation by these events. And adversity doesn't always mean traumatic, right? It doesn't, you know, on the outside of it, or words, it won't always mean traumatic. It just helps us. Many of our generations have been influenced in very good ways from adversity in their lifetimes. And this is pretty universal. But during that, right, we may see anger, and we might see disappointment and negotiation, right? And eventually we hope to get to acceptance that this is our new real for now. And we can do maybe even a more meaningful community graduation through yard signs and things like that. You know, I think I'm just texting somebody right now. I'm going to see if I can get some yard signs. I'll put them all in my yard. So finding ways to really show the support, because seniors and everybody deserves that recognition.
Yeah. And people are getting creative. And Christina, I'm going to call out your comment in the chat box because it's, you know, it's so true, you know, and you wrote, and of course, as they always do when there's a crisis or a death in the family, many communities are still dropping off casseroles and disposable dishes for families, you know, and so sharing food, you know, that's always a thing.
I think even some of the other things that rural communities are doing to get involved is we're hearing a lot about farmers having to dump food because there's maybe no way to get them to where they need to be. And in a county in Pennsylvania, you had people lining up in their cars to get dairy products that weren't able to be sent out. And there was another farm that was unable to get their animals to mass butchers. So they were actually donating them to families. So for a small fee, you were able to get, you know, a whole pig to feed your family. So I think that, you know, rural communities often come together and come up with those creative resources. But one of the things that I want to talk about that we hadn't mentioned yet was how about in some of these farming communities where we have maybe little mini communities of themselves of perhaps non-English speakers who come to work on the farms in the communities, and they're having a really difficult time finding resources because resources perhaps aren't available in their language. They have a fear of going to the hospital, to the doctors. So does anyone have any comments on how your rural community is supporting your non-English speaking population? Because that's definitely seeing a growth in terms of cases from what I've heard.
Yeah, I would ask the participants to let us know strategies or who really communities have experience in supporting that population. You know, something else I think is kind of not necessarily unique to rural, but certainly a trait of rural communities. In my experiences, we can be very outdoorsy, very outdoors oriented, you know, and spend a lot of time outside. And that can be good. It's a way to kind of, again, for our own mental health and stress levels, to get outside. We do have more space, you know, to move around and social distance in some often really beautiful environments that we can still take advantage of. I'm just wondering if folks, participants here, have had any activities or any strategies, you know, focusing on accessing those outdoor spaces. I mean, I know, again, the states vary quite a bit in terms of the state or local regulations, executive orders. Virginia, Tennessee shut down all of their state parks for a couple of weeks. They're reopened now. Virginia, I think, has not shut down its state parks, but a local town in Virginia close to us has shut down their public spaces. So, you know, I think it's a strength for the rural communities to have those outside spaces and to be so actively oriented, and yet it's a little bit threatening when maybe we can't access them like we're used to. So here's someone from Virginia Wade said to all participants, I've been providing mental health services with a deaf family using a translator as an additional participant in our telehealth services. That's interesting. Just looking at any other chats coming in. Okay. So I don't know if anybody else had any other comments on working with non-English speaking populations, or just thinking about the outdoor spaces and how that can be used to support communities and families. Any of our panelists have any thoughts on those things?
I see that someone had chatted up higher that they're using an interpreter with three-way calling and Zoom to provide services. Okay. So I think if you can reach the community, that's a great way of getting started. Maybe once you win their trust and they see that that's a safe way of getting services, they'd be more likely to share with their people that they know.
Yeah, and we have a national forest here in Southern Illinois, and the more tourist type of spaces have been closed, but then there's a lot of other trails that people can go to, and there's lots of nice things, nice events, and are coming together doing those types of things, and you can still keep the distance, as Chris was saying, you can still keep the distance to do those types of things. And then we're also, as part of relief types of supports, in addition to purchasing food and phone cards, and we're able to give out, like, there's like 4,100, over 3,000 kids that we're trying to give things out right now for. We're also giving kits for developing their own personal garden. Because with social distancing, with that practice, we may be looking at a longer plan. As it's coming into the rural community, it may be a longer plan where we might be looking at this even 4, 5, 6, 7 months from now. And that investment of food now, but also developing the access to food in the future.
You know, that's a really good point. A lot of these communities are, as someone had mentioned earlier, there's a lot of poverty, and I know around where I live, a heavy reliance on the food banks, and the food banks have not had food. And not only that, they haven't had volunteers because of most of the volunteers are older in that vulnerable population. So, so finding ways to make those investments. I know here the schools are still distributing lunches for the schools, even though the schools have been shut down for a period of time, but they are still doing, you know, regular, making the meals because we have such a high dependence on free lunch. And so, so those lunches are still being delivered. And I've even seen, like, on Facebook pages, some of my friends encouraging their friends that have school-aged children to go ahead and get the meals, you know, that to not be embarrassed, but go get the meals. So I see people doing that. I've seen people, again, posting in those, you know, those, what's it, neighborhood, what's it called? It's not Neighborhood Watch, but it's that app, you know, that's My Neighbor or something like that. I can't remember the name of it. But there are even people just sort of posting and saying, you know, I'm healthy, I can go to the store, you know, just let me know what you need to pick up. I'll drop it off outside. I've seen that. I've seen, you know, a lot of grocery stores here are like setting aside the first hour that they're open for people that are older or have, you know, compromised immune systems. So there are ways, I think, that people are trying to come together to help each other and to show support. Lots of Zoom meetings. I think even professionally, a lot of our things that we used to take just via conference call are being converted to Zoom meetings or other ways where people can actually look at each other and feel more connected. So I do think rural communities, you know, one of our, as Christina, you had said earlier, one of our strengths is that we do tend to come together and take care of each other. We have a history of doing that. We often get the short end of the stick on resources in any number of ways you want to look at it. And so we know, you know, how to sort of fend for ourselves and support our neighbors and really stay together as a community. So, you know, I'm optimistic that those traits will come through during this time, you know, and that we'll come out stronger on the other end. So that's my.
If I can chime in again, as far as the food banks, it's kind of the flip side here in Carbondale. I actually, there's a food bank in my church and I volunteered and they said, no, thank you, we don't need you right now. And I thought that was really great. In addition to that, Christina, what you were saying about reaching out to the immigrant or non-speaking community, I also am a part of the Latin community. And the thing that is difficult with that population is that they're so used to kind of blending into the background and not being seen because they're afraid. So the best thing that I've found is just to reach out to them. Whenever I do go to the food bank, I get an additional box of food. And even if they don't come to the door, I've just left it outside the door. So with neighbors that I have and additional family members. So that's another way to be able to reach out to that population. Yeah. And where if they've never sought, you know, our assistance before, it might be an opportunity to get them to do so.
Mm-hmm. That's a good point. I just saw somebody asked where they can find a recording of this webinar. You will receive this via email, a recording of the webinar, and also as people were posting resources, we'll also be sending you the list of resources that came through in the chat box. We've only got a few minutes left, and so I just wanted to give each of our panelists an opportunity to say, you know, any final thoughts that you want to share as we're winding up here. I'll just go across my, okay, go ahead, Chris. I was going to call people.
I think there were a couple of points where people were able to talk about how in this crisis there is opportunity, and particularly I think for the rural community who in many ways I think have been left behind by some of the service delivery options. This crisis may actually result in a greater comfort and a bigger focus on the need for telehealth that could actually address some of the access issues that I think are so critical in your community. And being able to bring the service to where the recipient is, cutting down on the long drives and the cost associated with that and the lost time at work or doing other activities could be incredibly powerful and helpful. I'm hearing about young people who were very difficult to actually engage in person in therapy, being much more responsive to these remote technologies. So I think there's a great opportunity, and I encourage people who are doing this more than they had previously to start capturing anecdotes, capturing some qualitative data, even quantitative data if you have that capacity in the midst of a pandemic, and to start thinking about ways to ensure that when this is over, we capture the best of what worked during the pandemic, because there are probably a number of approaches that we're going to want to continue after the pandemic. And then something I learned from a very wise person on one of our earlier calls is just do your pandemic best. And really, you know, do some forgiving and celebrate your successes, because there's no script for this. We're all creating this on the fly, which is why this kind of conversation is so important. It's sharing what we're all doing in real time to adapt our practices on the fly to a pandemic that nobody expected in our lifetime. So, you know, here we are, and now we need to figure out how we're going to work our way out of this and how we're going to continue to care for each other.
Thank you, Christopher. I think we're just about out of time. Does anybody have any last burning statement to make? I need to pass it back to Denise, I think, if everyone's good with that.
I'll just say one thing. Having in a prior life been through a number of sort of disasters such as hurricanes, the BP oil spill in Louisiana, the one thing I think that we're keeping focused on here, and I think we might all want to think about, is typically in disasters, the event itself is 5% of the activity, but the recovery is 75% of the activity after that, and sort of rebuilding and rethinking what we're doing. I think that's probably going to be the case here. You know, the disease will come and go, but it's going to leave a lot of structural problems behind, related to unemployment, for instance, related to avoided care that people have put off for many months. And so, I'd really encourage people to start thinking about that recovery effort, and putting some resources into that. And that also, I think, helps bring a little light at the end of the tunnel, so that it doesn't seem like where we're at right now is going to happen continuously for months on end, but we can actually start to plan our future.
Well, thank you to all the panelists. Denise, are you there?
I am. Thank you. And I want to echo Michelle Boardman has in the chat box. Thank you again to everyone for your patience with the platform and with our technology issues. On behalf of the University of Maryland and the TA Network and the rural learning community, I want to thank all of you for participating today. The panelists and all of your active sharing in the chat box have demonstrated that together we are truly stronger in creating those forward-looking solutions to meet the challenges of a brighter tomorrow. Thank you for your commitment to rural communities. Please continue to take care of yourselves while you're taking care of others. And please join us again. Thank you.
Thank you.